should I do that too?
And when I talk, I say, will they hear me on both? Let me see here. All right, perfect. All right, great. Okay, Elaine. All right, good. Okay, so thanks. Yeah, I like that. This is Dr. Nacho. One of the things I like to do is bring good ideas to dentists. There's so many interesting things in our dentisting world that we don't even know about because we work in what I like to call caves. Eric Cornelius taught me that. So a lot of dentists are in their own caves learning. So I want to bring good ideas what you guys are doing. So I'm happy to have here Elaine Rodriguez, an awesome hygienist doing some awesome things. Elaine, welcome to Talking Nachos with Dr. Nacho. Always want to be a talk show host, so this is me living this dream. Tell us about what you do and how you help dentists.
Hello, everybody. Thanks for having me on. So I'm Elaine. I'm the owner and founder of Dental Laser Integrations. So we bring laser certification and team training to you. So I started off just extremely interested in lasers, and then I saw what it could do to my practice and saw what it did for my patients. And then as things started to grow, I started looking around for more training options. And a lot of my colleagues were not trained because one, you might have several doctors and hygienists and assistants in one group practice, and it's just too much to get everybody on a plane over to a course. So it's really important, and it's really my mission to be able to bring the quality training to you.
I like that. That's one of the things is, in dentisting, it's hard, whether you're a hygienist or a dentist or assistant, it's hard to learn something in one environment, then bring it back to your practice. I've been teaching CE for 15 years, been going to CE for longer than that. You sit there, you think, oh, I'm going to do all this. Then you get back into the game and real world of dentisting happens. So I think that's great. So tell us, I know my dental people, hygienist people, they love to know how things work. What would you use a laser for in a dental practice or as a hygienist?
Okay, so the primary purpose is for perio. I mean, hands down perio. So, and it's transformational. So people or patients do not come to the office to get their gums cleaned. They come to get their teeth cleaned. So in hygiene, it becomes transformational in perio because you're bringing in that preventative side of things. And then for doctors, sometimes it is just a toy. They're using it to improve gingivectomies. Usually the two treatments that we focus on that are not done primarily are fibromas and biopsies, splenectomies, and it's just really a better way to trough. So not so much on the doctor side, it's more of a tool there. And unless you're looking to integrate it into your sleep medicine practice or a myofunctional therapy practice, you're most likely going to get best use of it for your hygienist.
I like that. So there's a lot of different modalities in dentistry. I think it's cool. We have so many new things, but whenever something new comes out, it could be controversial. And some people say lasers aren't new, but sometimes they're new to dentists. One day there were silver fillings, then there were tooth colored fillings. One day there were only bridges, and then there are implants. So you could use it for all different things. Does it help with some periodontists I know, and some dentists using it around problematic implants? Have you seen it used for that?
Oh, yes, absolutely. And it all boils down to what type of laser you're using. So you have some lasers that are inappropriate for implants and some that work much better. And then when it comes to that, it depends on what are you willing to pay.
And I would like to say to my dental notch community, whether you're watching this now, whether you're watching it 10 years from now, my goal is to bring good ideas to you and for you to JFO about it. So what's JFO mean, Elaine? Just find out whether it's about lasers or a new platform. We're always growing. ABCs always be changing. So I like that. So let's say that I'm a dentist. I have two practices. That's true. I have multiple hygienists. I have a lot of busy things. I say, I want to get started with what you do. Tell us how you help offices and how we would get started with something like that.
Yes. So initially do your due diligence because it is an investment. You're looking at time, energy, and effort in investing in the team, getting the team trained. And on top of that, you're looking at what do you want to pay? What is your price point for the laser? So I am doing a free webinar. So I do a free webinar to help offices decide, is this going to be a worthy investment for me? Is this something that my team wants to do? So I would say, number one, do your due diligence, talk to your team and see how they would like to incorporate something new. On top of that, once you've decided and you've purchased your laser, and by the way, I'm not involved in the sales of lasers. So my goal
is something, I know my dental people, and you're a lot younger than me, but I like the prices right when I was a kid, how much things were going. What is a range for utilizing a laser? I'm actually totally curious. Let's say someone says, I'm going to budget for this laser? Is it 10 to 50,000, 25 to 100,000, 50 to 150? What's a range for the lasers that you're working with most often?
So for the soft tissue laser, you're looking at 2,500 to 8,000.
Gotcha.
Some lasers just do soft tissue, some do whitening and pain therapy. So it really just depends on how versatile you want to be.
Gotcha. So that's something that's a digestible, Nacho term, digestible cost for the office. Well, I love that what you're doing with trying to get offices to just find out, get offices to try something new. In my house, we watch a lot of Daniel Tiger. He always is talking about trying new things. So if someone wanted to reach out to you to learn more about working with you or to be part of one of those webinars, how would they do that?
They could just go to my website, www.dentalhygieneculture.com, and go to the webinars tab and sign up. I have them running on East Coast, Central, and West Coast.
Awesome. So www.dentalhygieneculture.com. And what if someone wanted to email you? How would they email you?
They can go to Elaine@dentallaserintegrations.com.
Elaine, well, Elaine, thanks so much for being on with us. I love bringing new ideas. I love, thanks for being such a JBN person on the Dental Nachos team, Nachos group. We need more JBN and less TSD out there, more JBN. So thanks guys for being on with us. Reach out to Elaine to find out more and have a great Nacho day.